Hello to our friends in the Kansas City area. Welcome to this educational discussion today about all things COVID-19 vaccine, presented to you by Lakeview Village Retirement Community. Hi there, I'm Melissa Smith. I'm your facilitator for this event today. And here's what we plan to accomplish with you. We have so many questions out there about the vaccine, right? With so much information floating around on the internet and social media and in the news. And I don't know about you, but the relatives, they're all sharing what they think is happening around the vaccine as well. It's really kind of hard to tell sometimes what's fact and what's fiction. So we really appreciate you being here and trusting Lakeview Village to provide you with the accurate answers. To ask your questions today, here's what you do. Right under this box that I'm sitting in on your screen right there in front of you is a form. Just type in your name, type in your question, and hit submit. That question will come straight to us, and we will get your questions answered. If it doesn't happen immediately after you send it, I want to promise you that we will get to it before the presentation ends today. Well, our Lakeview Village Medical team, they are here to answer your hard questions with transparency around the COVID-19 vaccine. Of course, with the goal of setting your mind at ease about receiving the vaccine. So we will pull our doctors in shortly. But right now, I'd like you to meet a couple of other people at Lakeview Village, a couple of members of the Lakeview Village leadership team. We have with us Robbie Clausen. Robbie is the president and chief executive officer. And we have Pam Herman. Pam is the chief operating officer and a registered nurse at Lakeview Village. How's it going today, you guys?
It's going really well. Really appreciate everybody attending the event today, and looking forward to the presentation from our doctors. They have done a wonderful job for us through this whole pandemic and transition. I think you guys will really enjoy what they have to say. Pam?
Yeah, I'm glad to have you guys with us today, and it's always exciting to hear from doctors to take time and talk to us about the COVID vaccine and kind of give some explanation that answers a lot of questions that we sometimes have to pay for. Now we get to actually hear it from the doctors without paying. Okay?
And we'll get the, yeah, no kidding. And we'll get the questions answered. And that's what's awesome. Right. That free advice, right?
Yeah, it's a free advice that you don't get.
That's right. So that is very exciting. So I think before we get to that, though, it would be great to understand how the vaccine rollout is going right now at Lakeview Village.
The vaccine rollout here at Lakeview has been absolutely 100% success. We've had over 1,200 vaccinations given between residents and staff here on the campus, and also caregivers. We are pretty much through the second round of doses. We've got, I think, about 150 left to give in a final clinic in a couple of weeks. And it really has, really raised morale here, really has helped all of us kind of feel a lot better that, there is a light at the end of the tunnel and there's some hope.
I bet it has. Pam, have you been getting that same sense there around the community?
Yeah, I think both the residents and the staff, that first vaccine clinic, I think we all kind of walked away going, we've been waiting on this for a year, and it finally has shown, and kind of some hope that things are going to return back to normal soon, and whatever normal will be, we're ready to face. But I think that community of just feeling like we did something to try to stop the pandemic.
Absolutely. Yeah, you talked about returning to some sense of normalcy. And I know this is the million-dollar question. Do you have any idea when you really feel like Lakeview Village will be back to normal?
Well, in some ways, Lakeview, the new normal is already here. Throughout the pandemic, we took many strides to try to maintain safety for our residents and for our staff. And tried to keep the interactions, even if they had to be through Zoom or some other method, trying to keep those connections and keep everybody plugged in. Even in our licensed areas, we did visitations through outdoor visitation tents, things like that. We've also done Zoom, FaceTime, all ways to try to keep people connected. And really the main thing was to maintain those connections so you can maintain that feel of community.
Yeah, it sounds like you were successful. Maybe give us some examples, Pam, of how you all were keeping people connected during this time. And I suppose you're still doing it because we're not back to normal yet.
No, so we, especially with the independent living side residents, probably for the last 6 months have been able to have indoor or in their own apartment visitations. They just have to go through screening to be able to go up and see their loved one in their apartments. So on the independent living side, we've tried very close to get as much back to socialization as you would at home for the residents. They're able to, families can visit in their apartment just like they would if it was their own home. They just go through screening to get there. For the licensed areas, it's been more visitations through Windows, as Robbie said, Zoom. We've done FaceTime. We have a heated tent outdoors.
Nice.
Residents' families can actually sit and visit even when it's cold. We have a wonderful remodeling team here that has built I'm going to say it's a wall that you can see through, that you can put your hands through, and some with gloves, and actually hold hands with the resident on the other side, so that there'd be some touch. That's the one thing that is so hard through a pandemic of this type is that personal touch that's been missing, especially for family members. And I think that has been something that has really helped our residents still feel connected to their families.
So you're obviously going on with visits. People you're keeping your screening protocol, it sounds like, but visits are definitely happening. They're just happening in a very safe way.
Yeah, I mean, the goal here is to maintain social distance. Of course, they're wearing masks, and then trying to just promote meaningful interactions between the families and the residents.
Got it. And what about move-ins? Are residents still moving into the community?
We have all kinds of residents moving in. We've got new construction going on here on campus, so they're building some new villas down along our lakefront. We also have residents moving into our South Ridge and North Point buildings, and here in Heritage and Garden View. So throughout the campus, we continue the move-in process. It really only slowed up a little bit at the beginning of the pandemic, but since then, we have definitely made sure we can accommodate anybody who wants to come and join our community.
Awesome.
I mean, when they come in, they're going through the process just like our residents do. When they want to come in and do a tour of the campus, they go through the screening process. They're wearing a mask, but they're able to see anything they would like to. I think they're having interactions with staff as they're going through. And I think that also is showing new prospects that we take, seriousness about this pandemic, and that I think that has been a good thing for people to see what we do here on campus. And I think that is probably helped with some residents even feeling comfortable leaving their home to move into a community, feeling that safetyness.
Yeah, you bring up a really good point, and that is, for those residents who have been living alone during this time, how difficult that has to be for them, where those who live at Lakeview Village, they have the support of the staff around them, of phenomenal meals, of ways to connect with one another, that makes, like you said earlier, Robbie, it is a community, right? It's more than the neighborhood. You guys are a family, a community.
Yes, very much a community, and even throughout the pandemic, the residents have been able to continue to play cards and do puzzles and connect on their hallways and on their floors throughout, so that they're able to stay connected and plugged in, which is what we want with a community like this.
Sure. Anything else you all want to bring out before we pop over to our doctors?
The only thing I can say is you definitely want to take a look at communities like this. We have the ability to be able to bring a lot of services and be able to really get you plugged back in, so you aren't alone and isolated out there in your home. And then you've got a whole new bunch of friends. We've got several residents say here it's kind of like going to college. They got a whole new set of friends when they move in here. So I think you'd really enjoy joining us here at Lakeview.
That's a great analogy. Pam, any other thoughts?
I was just going to say that the sense of community, I think, is why most people move into Lakeview. We offer a lot of great services and a lot of great expertise here on campus when you might have a concern or problem that you need to work through or a medical issue. But I think what everybody enjoys about Lakeview, both staff and residents, is the sense of community and the feeling of family.
And spring is going to be here before we know it. And I know there's a lot of great stuff to do outside of Lakeview Village too.
Mhm.
So that'll be nice. Absolutely. Robbie and Pam, thank you both so much.
Thank you for the time today. We'll
Thank you.
appreciate it.
Absolutely. And if by chance those of you at home would have a question for Robbie or Pam, certainly you can use the form that's right here on the screen just below the box that I'm in, but you can also reach out to Lynn Tenbrink. And we've got Lynn Tenbrink's information here. Her email is Tenbrink, that's TENBRINK at lakeviewvillage.org. Or you can call her at that number there on your screen, which is 913-744-2447. Well, now let's get to your vaccine questions. And to answer those, we want to bring in here a couple of our doctors. We have Dr. Stephanie Garcia, who is the medical director for Lakeview Village, along with Dr. Ryan Sears, who is really a local expert on COVID-19 and the vaccine. Thanks to both of you for being here. And I know, Dr. Sears, you've been doing the circuit all over town in Kansas City and surrounding area, talking about the vaccine and talking about COVID-19. So we feel very fortunate to have you with us as well. And I think it's important to let our attendees today know that both of you are board certified geriatricians, and both of you are on the long-term care COVID-19 task force for Johnson County, which just means you're in the know. You know what's going on with this. So thanks again to both of you for being here with our attendees today. So Dr. Sears, if you would just kick us off and kind of give us a brief overview, and then we're going to get into the questions.
Well, sure. And thank you very much, Melissa. So one of the things that we want to talk about, of course, is what COVID-19 is itself, and what are we doing to prevent it now, and what can we do with vaccination. So COVID-19, as many of you are already aware, is a primary respiratory virus. Because it's a virus, we have an opportunity with things like vaccination to really prevent people from getting very ill. Unfortunately, the virus is so widespread still, even with the recent decline in our community and in the nation of cases, that we really need to have additional efforts to get rid of the virus and or prevent people from getting ill. And so that's why it's so important that we need to talk about vaccination, because vaccination is truly the best way that we have to get a hold on this virus and to really prevent it from altering our lives and affecting our family, friends, and preventing us from interacting with one another. If we're going to truly get back to what we consider to be more normalcy, we really need vaccines to be the forefront of our prevention efforts. Now, it's going to be a complement to some of the things that we already do that are proven to prevent people from transmitting virus to one another. One of those things being wearing masks. Another thing being distancing from others. But truly, we don't want to be in that kind of environment forever where we're having to distance and not see our family and friends. And the best way to really get past this is to use vaccination. Vaccination has been around for hundreds of years. We've only gotten better over time at using vaccines to truly protect us. Things that many of you may be familiar with, such as polio, are now on the verge of eradication in the world due to vaccination. So it's truly one of the best things we've ever done with medicine. And that's why it's so important for so many of us to get vaccinated.
Well, I really appreciate that. And thanks for kind of setting us up and setting the tone for this next discussion, because, I've been listening to and collecting some of the major concerns that continue to be discussed around the vaccine. And some of our attendees, well, they're looking for logistics, where they're going to get it, when it's available, the efficacy of it, and more. And then there's others who they're not quite ready to roll up their sleeve yet. So I thought maybe we should start with some of the basics around the vaccine, if you will. And the number one question that still pops up is this vaccine really safe?
Yes, I mean that's the principal question that everybody asks right off, and it's the most important one to answer. The vaccine itself, and when we say vaccine, we're really meaning several different vaccines. The two that are available currently are based on technology that we've used for nearly a decade now in people treating cancer. So it's important to remember that this technology, while being new for this particular virus, is not new to humans. It is not new to research. We have information about the safety of this type of technology from other uses. It's also important to remember that these are the largest vaccine trials that have ever been conducted, and they're ongoing. Not only did we collect information on vast numbers of people, and each one of these particular ones, both in Moderna and Pfizer, 50,000 people were involved in the trials initially. But it's also important to remember that it's not just those people, but it's the 52 plus million in the United States and then many more in the world where we're still collecting data. And it's shown, even over the last month, that these are very, very safe and effective vaccines. And what we mean by safety is the side effects, the adverse effects that we may see with the vaccine are very, very low. Typically, what we're seeing is things like fever, body aches. Sometimes we do see people have fatigue, and these are the most common things, as well as, and you probably have already heard about this, people do have soreness at the injection site. Now, both of these vaccines that we're referring to are two-shot series, meaning that they are a first shot and followed by a second shot. And people usually will have more symptoms with either the first or the second vaccine, and that's expected. However, it's important to know that people older than 65 tend to have less of these symptoms. And so that's another good thing about the vaccine is that we do see less symptoms as we age. The other thing that it should be important to point out is that vaccines in general are very, very safe. There are always people out there that have a propensity to be against vaccines. But in general, vaccines are very safe because they're a generally one time or two times exposure, and then we're done. And the reason why we see more side effects with things like medications is because they're taken every single day, and they have the ability to affect you every single day and change how your body functions. A vaccine, on the other hand, generally lasts in your body for a very short period of time, whatever we're injecting. In this case, it's mRNA, something our body uses on a consistent daily basis. And frankly, we wouldn't live without mRNA. We are injecting a small amount of that only encodes for a basic protein that the virus uses, so not the virus itself. And because it does that, we are able to inject that and only have that last for a short period of time, followed by an immune reaction. And again, that's what makes vaccines in general so safe, is that they're very short-lived in your body. And then it's up to your body then to remember what this protein that we've just introduced it to looks like, so that the next time the virus itself comes around and you're exposed to the virus, your body remembers what that looks like and then can attack it. The
That's
most
amazing.
common side effects that we have concerns about tend to be related to more, the severe things that people are talking about, like anaphylaxis, or severe things like Guillain-Barré. It's important to remember that anaphylactic cases are incredibly rare. Incredibly rare. I am more likely to be in a car accident today than I am to have anaphylaxis
Okay.
from any of these vaccines. In fact, we've recorded less than 100 cases out of 52 million people that have received them. And
Wow.
so we can speak to a lot of these effects throughout this conversation here, but the bottom line is that these are very safe vaccines. They've been studied for a long period of time. The reason for these 8-week time frames that they had to meet to be studied was because all the major effects or side effects from a vaccine will show up within 8 weeks. And so if we're not seeing that within that time frame, it's important to know that it's a safe vaccine.
Oh, that makes so much sense.
Yeah.
It does. Doctor, I want to bring Dr. Stephanie Garcia in here because of everything that Lakeview Village has just gone through with the vaccination rollout happening there at the community. Congratulations, by the way, that has to feel really good. But what did you see, Dr. Garcia, as some of the most common side effects for the older community?
Hi, everybody. I'm Stephanie Garcia. Thank you, Melissa, and everybody for having us. I'm actually at the Lakeview Village Clinic right here now. It's in the background. So thanks for listening to us today. Yes, it was really exciting. I think we're finishing up our third clinic this week, as a matter of fact. So we have vaccinated about 1,500 people on campus. I would say probably 75% of them, are over 65, because that encompasses clinic patients and independent living. And then the staff and employees and healthcare workers like myself would be included in the under 65 group. And we actually had 0 out of 1,500 people, 0 major adverse events. I think I may have known of 1 or 2 people, and this again was the younger crowd that tends to have the more intense, I guess, not even a reaction, but fatigue, chills, maybe even some sort of allergy type of reaction. They were younger employees, I think 2 people. So really that's pretty good for all the different age ranges we were vaccinating across the campus, and no known effects in any of the residents that I'm aware of.
Awesome.
So yeah, it was really awesome. It was, I'm sure that you guys heard Pam and Robbie. It was kind of like a party for all of us. It was a celebration coming out of a lot of long, dark months to get the vaccine. And it was good. It was great. It was a good time. It's weird to say that about a vaccine, but it was.
I know. Isn't that amazing? Yeah. Who thought we'd be talking about it like that, right?
Yeah,
except for everything we've been through. I'm sorry?
I mean, the first day when I got mine, I just had chills, walking in there and seeing some of the residents and how hard everybody had been working. So it was a pretty powerful experience, really.
I bet it was. So I'm going to hit some of these questions that I know come up from time to time, and we can go through these. And again, if you have a question, fill out that form that's just below us on the screen here, and we'll get your question asked to our doctors as well. So what about this one, doctors? Will the vaccine give me COVID-19?
Yeah, so it's important to remember that the vaccines are not capable of doing that. Mechanically, the vaccines contain just a small portion of the virus itself. This is very consistent with other vaccines that we use, the non-live vaccines, such as the flu vaccine, which is not the actual virus itself, but a much smaller portion of the virus itself. And in these cases, it's even smaller than that. It's so small portion of the virus to not be possible to make the virus itself. Also, it's important to remember that these vaccines have very minimal in the way of preservative medications that make these vaccines last longer, which is another reason for the cold storage that they have.
So when we have those side effects, and it sounds like, did I hear this correctly, that some of the younger folks may have or tend to have more side effects than the older folks? Did I hear that correctly?
Yeah, and it's just because of younger people have a more robust immune system. I mean, as you age, you get to be an immunocompromised state really just by your age alone, especially when you're talking 90, 95, 100. I mean, we have more than several of those age ranges on campus. The immune system, little babies get temperatures of 103, 102, and that immune system just attacks everything it sees. Older people, that doesn't happen. A lot of times they can be very, very sick and not even have a fever. So that's what we're talking about there.
Okay.
They're still mounting an appropriate response. It's just different. It's not as robust, which is why it's important for them to get 2 vaccines and not 1, which is what Dr. Sears might touch on that later. But
cool. Okay, thanks for that clarity.
Yeah, and Dr. Sears can speak to that too. But really, all the I would say people that have had, even myself, didn't feel well for a couple of days. None of my actual patients that I take care of as a geriatrician had any complaints. So I was telling them, I don't know if it's because, my generation is a bunch of wimps and they're not. I don't know, but that's how it seems.
Sure,
Yeah.
that's
Yeah.
that's a good answer.
Yeah.
To touch on that, Melissa, too,
Sure.
the other major, side effects that people get worried about are two things that people talk about are Guillain-Barré, which is a neurologic condition that causes weakness in a person's lower extremities. Fortunately, we are not seeing that with the vaccine itself. We've just not seen cases, and worldwide, over 140 million people have been vaccinated with this. So we should see cases if that's going to be the case. But Guillain-Barré, unfortunately, does happen with COVID-19, the actual live virus, if someone were to have the infection. It's also important to remember it's much more common that Guillain-Barré happens with infections than it ever is with vaccines. The other one that people keep talking about, and it's true, that can happen with vaccination is Bell's palsy. Bell's palsy is a temporary reaction that we have in which we may have a small paralysis of the facial muscles on one side. Bell's palsy can happen with vaccination, still very, very low numbers. But again, it's important to remember it's more common with infections, and it's more common with COVID-19 than with the vaccination itself. So we're simply not protecting people by saying don't get the vaccine from Bell's palsy and definitely from Guillain-Barré as well.
I hadn't heard that. So thank you for that. That's interesting information. We are hearing about these new strains or these new variants, and I think there's a difference between the two. You'll have to help me with that one. But the new strains, the new variants that are popping up, and I know in particular, Great Britain has been a focus in the news on that. Will this vaccine cover variants or different strains?
Yeah. And I'm going to speak on the goals of the vaccine as well a little bit later, but that comes into that. What is the goal of this? Truly, the vaccines are covering against these other strains, variants, mutants. These are all words that we may use for different versions of the same virus that now have different abilities. They may be able to be transmitted easier. Maybe a person will produce more virus because of a different variant or mutant. That does not mean necessarily that a vaccine won't be effective. And what we've seen so far, fortunately, is even in the other vaccine trials, such as Johnson & Johnson, Novavax, these are some of the single shot vaccines that will be coming out, that they're highly effective at preventing people from getting severely ill, and still highly effective against people having symptoms. And we expect the Moderna and Pfizer vaccines, which we have seen already, to have even more efficacy against having severe illness or having symptoms. So again, that kind of speaks to goals a little bit, but we are seeing that it's very effective against these cases. But it's also, I wouldn't want someone to put off a vaccination based on any kind of variant, because simply right now we're running into all sorts of different versions of this virus. And the fact of the matter is we need to protect against as many sources of the virus as we can to prevent the virus from getting into more people, but also to prevent the virus from changing itself. The more people get infected, the more chance the virus has to change, the more mutants, the more variants are out there. If we can get more people vaccinated, the less likely the virus has a chance to change itself, because it has to change inside of people.
Interesting. That is so interesting. I didn't know that's how that happened. Let's move into now a little bit more about getting the vaccine, because most of the folks attending today are in Kansas. So if you're in Missouri, I'm sorry. Well, maybe you guys can talk about that too, but I know that you will both are sitting on this special long-term care COVID-19 board for Johnson County. So we're sort of speaking to the Kansas knowledge, but those over 65 right now in Kansas are qualified for the shot. But there is still just so much confusion about how and where folks are to get this. Do you all have any advice around that?
Yeah, I mean, certainly I can speak to a variety of different things. And unfortunately, we don't have just a central system in which we can say, okay, call this number, get on this website, and this will fix it all. This is a rollout. Things will evolve over time and things will get easier over time to access the vaccine, fortunately. For right now, my best advice to you is to, number one, reach out to multiple different sources. That potentially means reaching out to the county health departments, but they're experiencing a lot of overwhelming, seeking a vaccine right now. So some of the other resources that are available are your local pharmacies. They may be able to direct you to which pharmacies locally may be able to administer a vaccine for you. CVS, Walgreens, some of the Hy-Vees in the area are receiving vaccines. So it may be time to reach out to them and ask them if they're ready to start signing people up. And you may be able to get on a list where they contact you back. The other thing is to utilize, our people that are tech savvy. That doesn't always mean that are younger, but many of us, know younger people that are very tech savvy and can get onto many of these websites where we are seeing the signups. Unfortunately, some of those signups are only for a brief period of time before they get completely filled up. So it may be really essential to get somebody else that like a child or a grandchild, to start working on that for you. One of the resources that I'll send people to is npr.org. That's National Public Radio, so npr.org. If you get on that and search in the search bar shots, that will direct you to their site that actually informs you on how you can get vaccination in your local area. So you type in your address, your zip code, and that will direct you to some resources in which you can seek vaccine.
Well, and I appreciate you bringing that up about technology, because I do think that for some of us, some people just aren't on their computers all day long either to notice if something would come in and there be some available times, whether it's through your hospital or through a Walgreens or CVS or what have you. And so having somebody in your court to help you do that, and Dr. Garcia, it makes me think back to Lakeview Village. I mean, how fortunate everybody at the community was to be able to get that and not have to go through the headache the rest of us are trying to figure all of this out. So no, I appreciate that about npr.org too, so we can check that out. Did you want to add anything, Dr. Garcia? Sorry, I think I cut you off.
No, it was just pretty remarkable that we were able to do that. Have all the independent living residents get their vaccines. Plus, we got to add on a lot of the clinic folks that come here that don't live at Lakeview Village, but they use the clinic as their primary care. So it was really good that they allowed us to do that. So, yeah.
That is great.
Okay, here parents to get theirs. So I'm still looking for vaccine other ways as well. My parents that are over 65.
Yes, I hear you. We're all keep looking for it for sure. Okay, so what if I've had COVID-19? Here's a good question. What if I've had COVID-19? Should I get the vaccine?
So yes, absolutely, for sure. We just don't know enough about the virus yet to say, even if you've had COVID-19, how long your immunity lasts exactly and what that looks like. So absolutely, for sure, get the vaccine. I think there was another question on there that maybe I should just go ahead and answer with that, as people will say, well, if I've had COVID, how long do I wait to get the vaccine? Or if I have COVID now and there's a clinic that opens up to get a vaccine, can I go?
Right.
And what we're recommending is that it be at least 14 days from your positive COVID test. And of course, you have to be out of that isolation period or quarantine so that when you go to get the vaccine, you're not going to potentially infect someone else. But definitely 14 days from your positive test before you can get or be eligible for the vaccine itself.
So just be aware of that. That's good advice. Okay, so what about this one? If I get the first vaccine, is there a risk that the second vaccine won't be available when it's time for me to get it? And I think there's also some concern question around the time frame, because what if I'm supposed to get it in 3 weeks, but I don't get it until there's 4 weeks? Are there issues around all of that, doctors?
Yeah, I think it's important also for people to know that while we're rolling out, we have shortages of vaccine. And the most important thing is that everyone gets that first dose as soon as possible, and that we can roll out to as many people as we can, because that first dose in many studies now has shown to be effective at preventing severe illness, effective at preventing people from being hospitalized, and very effective, fortunately, at preventing people from dying from COVID-19. Now, unfortunately, as Dr. Garcia alluded to, we do know that in our older population, that we do find more trouble with being efficacious with just one shot. So it is going to be really important to get that second one. Now, will there be ready access for everybody immediately? Probably not. I mean, there will be some difficulty getting that second shot. I can speak to that because my mother's one of those down in Oklahoma. And so she's gotten the first, but it's okay that you don't get the second one till later. The
Okay.
CDC has put in clear guidance out there that we can administer weeks after that first shot is, or the second shot is due. And frankly, mechanically for these vaccines, it makes a lot of sense that anytime that you're able to get that second vaccine should be fine. Again, the way this works is it's going to boost up that immunity with that second shot. That boost, you already had a little bit of memory of what the virus looks like with the first shot. So getting that second one's just there to boost it up. And we don't really have evidence right now that prolonging that second dose does anything to the effectiveness of the vaccine itself.
Okay. What about mixing? Like I got the Moderna and now I have the opportunity to get the Pfizer. Does that matter?
Yeah, right now we're not advising mixing the two vaccines, and there is
Okay.
a reason for that. We're wanting to develop a robust memory for the virus to the specific protein that vaccine was designed for. So Pfizer and Moderna have slightly different mRNA that they've coded for. And so we want your body to recognize that same one and produce a robust response to it. There may be in the future a possibility that we will allow for that. And we do know the United Kingdom has done so. Our immune system is very complicated in that our immune system actually makes multiple different antibodies. And my immune system makes different antibodies than Dr. Garcia's immune system does to the same exposure. So it's important to remember that, yes, we will make different antibodies, and there's a possibility mechanically that getting a different version of the vaccine will be just as good. But right now, we just don't have studies to back that up. And without that information, we just don't have the confidence to say, let's mix one vaccine to the other.
Got it. I want to remind our attendees today to ask your questions. You have a really awesome opportunity. It doesn't cost you a dime. We've got the doctors in the room. Let's ask your questions. So all you have to do is there's a form that's just under this screen that you're watching this on live. And in that form, you just type in your name again, you put your question in there, you hit submit, and those will come straight to us. And I'm saying that because it's so unusual for us to not have any questions and for me just to keep going through my list. So I'm just going to keep going through my list, but certainly want to encourage folks to ask any time that they have a question that pops up. Okay, so let's move into, we talked a little bit about side effects earlier, but I think there's also a lot of curiosity around, how long it might take for those side effects to show up. And if you talked about this earlier, I apologize, but I think it's like, I've had family members get it and they're like, yeah, I know I had to sit there for 15 minutes, but does that mean you're basically done other than having perhaps some aches and things for 24, is it 24 hours? Is it 2 weeks? What's the rule with that? Or there's no rule, but what are you seeing?
So the first 15 minutes is definitely to look for that anaphylaxis, that severe response that someone's going to have when they immediately see the proteins of the virus, that they're going to react immediately to that and have the severe symptoms that we want to watch for. 24 to 48 hours, I would say, is pretty typical to have some arm soreness, fevers, chills, some body aches. A couple people, again, is it just because I'm a wimp and it took me 4 days to feel because I was tired? I don't know. But, I would definitely say after 5 days, whatever you have going on isn't the vaccine. And And again, my patients didn't complain at all. It was me complaining. So I just take that for what it's worth. But 24 to 48 hours is pretty much the typical, if this is going to be, if I'm going to have a reaction or if I'm going to have aches or chills, it's going to happen then. And then they can kind of linger for a couple days after that.
Okay, got it. And then I've heard that taking a pain reliever before you get the vaccine on the day you're getting the vaccine, that it will reduce its effectiveness. Is that true?
So that's based on some studies that were done on previous vaccines, especially for children. And it's not really based on our current vaccines yet. However, what we are being is abundantly cautious. And we're saying we do want this to be the most effective that it can be. And so we're not advising people to pre-dose with things like NSAIDs, such as ibuprofen, Aleve, naproxen, Advil, or Tylenol, such as acetaminophen, or aspirin for that matter. Now, if you already take those medications, we're not advocating that people should stop taking their regular medication. And especially you may want to discuss with your primary doctor if you have concern about that. What we are saying is that don't take an additional dose before the vaccine just to prevent symptoms. I can speak to the experience that I had, that it took about a good 12 hours for me to start feeling the chills, the fevers, and taking that ibuprofen or Tylenol when I had the vaccine wouldn't have really prevented that at all. But I did take Tylenol when I had those symptoms, and it reduced those pretty dramatically, actually, to where I was feeling pretty good for a good, 4 to 6 hours. And then I could redose, with a safety of the medication. You want to, follow what the pill bottle says on the amount that you can take. But again, taking after should be fine. We're just being abundantly cautious and saying, don't take any dosage before or right when you receive the vaccine itself.
That makes a lot of sense. And then again, taking it if you feel any side effects, take it at that time to just help you feel better.
Yep.
Yeah. And stay home from work maybe, or whatever that day. Not a bad idea, right? Take the day off and relax. And I guess that just means that it's working. Isn't that what that means?
Yeah, your body's mounting the appropriate response. But I had some of my older patients say, well, if I didn't get those symptoms, am I still having the appropriate response? And I would say yes. Again, it's just different with everybody.
Everybody's different. And Dr. Garcia, I meant to ask you a minute ago about, what about people who are allergic to like the egg allergens or preservatives? Can they still get this vaccine?
Allergies to eggs, yes, you can still get the vaccine. There is no egg in the COVID vaccine. They have listed on the CDC website a couple of preservatives that are in it. Dr. Sears, you might know exactly. I think one of them is the polyethylene glycol. That's kind of a common preservative. It's PEG for short, PEG. So if you had a known, there's not very many people that I've ever met that have a reaction to that, but I would say that's the one that sticks out in my head. If you have a known side effect to polyethylene glycol, you shouldn't have the COVID vaccine. I don't know if there's anything else, Dr. Sears, that you...
Yeah, I mean, it's important to remember that, there will be several more of these vaccines that are coming out, and they will have different preservatives. That's one of the reasons that they're more temperature stable. The current vaccines have very, very little amounts of additional components. The components we are reacting to that people typically have the anaphylaxis to are actually the protein that comes in it. It's actually an envelope that protects the messenger RNA that we actually use for the vaccine. And so that's common for people to have reactions to things like proteins, avocado, peanuts. That's the reason why we have those reactions, is actually to the protein itself. But exactly as Dr. Garcia said, if you have concerns about previous anaphylactic reactions that you've had and to specific components, then look on the CDC's website. They have the listed components, and they will list the components of the additional vaccines that will be coming out.
The egg is not an issue. Just remember that the egg is not a problem.
Okay.
Yeah.
That is good to know. Doctors, what are the goals with this vaccine, would you say? What is the big picture goal?
Yeah, I think that's the most important thing besides just the safety, is to remember that there is going to be more vaccines coming out, and those vaccines their effectiveness or their efficacy is listed differently, right? So it says, for instance, Johnson & Johnson, maybe 70% effective against the current variants that we typically see, and maybe 50% against the South African variant. Well, that doesn't mean that it doesn't provide really good protection, even with that just one shot that it does. It actually provides very great protection, prevents majority of people, 99%, from having a severe COVID-19 case, and the vast majority from going into the hospital. So that doesn't mean a vaccine's not effective, that it's 50% effective at preventing symptoms at all. And in fact, another great thing about it is it's still highly effective at preventing transmission. We're seeing that with the AstraZeneca vaccine, which is another goal of vaccines, is not only to prevent that person from having symptoms, but also to prevent that person from being able to unknowingly get the virus and transmit it to another person. So I think it's important for us to remember when we're looking at these vaccines and we're going, well, I want the Moderna and the Pfizer because it says 95% effective. Well, it's not that it's 95% effective. 95% of people who would be exposed to that virus will not have symptoms with this current variant that we were studying. And it's very high still, even with the South African, the Brazilian variants, the UK variants. So that's great news, but it doesn't mean that Johnson & Johnson, AstraZeneca, these vaccines are very effective at preventing people from being severely sick, which is what we want. If you simply will be more likely to have cold-like symptoms, that's still much better than ending up in the hospital.
Right.
So the goals are important to remember because, if that Johnson & Johnson is the first one that you're able to get access to, get it. Get that vaccine. I would take that vaccine every day, and I would absolutely advise my family to get that same vaccine because we need people to be effectively prevented from getting severely ill now. And we need people to be prevented from producing more virus and making more variants of the virus. So we're going to have a variety of vaccines come out. They're all going to have different numbers attached to them. It's important to remember so far, we have seen every single one of these vaccines be highly effective at preventing people from becoming severely ill and preventing people from dying. And also, so far, it appears highly effective at preventing people from transmitting to one another.
Terrific. You addressed Johnson & Johnson just now. Sally sent in a question saying, can you speak about Johnson & Johnson, and asked in particular about the one-dose vaccine.
Yeah.
The fact that it's a one-dose vaccine.
Yeah, and I'll field that one if that's okay. So yeah, the one-dose vaccination that Johnson & Johnson has, again, based on a little bit different technology. So they're actually using information still, using genetic information that is actually encoded and in a capsule of a different virus. So it's a little bit different technology that we've used in lots of vaccines before. So it's a little bit older technology, truthfully, but it's a reliable technology and it's something we've used before. So it's still very, very safe. And the trials have borne that out so far, that the safety is very similar to what we're seeing with Moderna and Pfizer. It is a one-shot vaccine, which is great. That means that we don't have to worry about that follow-up so much. The effectiveness or the efficacy is going to be slightly different at how many people it prevents from being completely asymptomatic, okay? Some people will have symptoms, but that still may prevent a person from being transmissible, even if they have symptoms. And we're seeing that, we've seen that with all vaccines in history, which is why we'd be completely floored if for some reason COVID-19 were able to be just as transmissible after you've received a vaccine as it was before. We just don't expect to see that. And so that's one of the reasons why we expect with vaccination to get to a broad level of immunity in the community once we get enough vaccines out there. Because even if it changes from 10 days being able to transmit the virus down to 2 days or an hour, that's great. That's great. That's a great goal to have because that's going to really prevent the virus from having a place to go.
Excellent. Eleanor asked a question. I think we've addressed it pretty much, but perhaps just another thought on this, and that is around how people have more severe side effect to the second dose of the vaccine, talking about, of course, Moderna and Pfizer, then to the first, what is your experience or recommendations to minimize that? Do you have any other thoughts you want to add? Because I know we talked about this briefly.
I can take that one and you can add if you want, Dr. Sears. I'm not sure there's anything that you can do to minimize the effect because, again, it's a normal response that your body's going to have, and it's individualized about who's going to respond in what way. As we've kind of talked about this a little bit when seeing people that get the vaccine that have already had COVID. Sometimes that first vaccine, they respond a little bit more robustly to than the second one because their body has already seen COVID. So they see that vaccine and their body kind of goes gangbusters on it and, tries to take care of it. So they have a kind of hefty response, fever, fatigue, and that kind of stuff. And then the second one, the body's kind of figured it out, so they don't respond, have all those side effects as much. Now, people that haven't had COVID, I think the general consensus is the second one is the one that is kind of more intense for people, again, because it's the second time it's a booster in a way. So the body's seeing a virus again, and it knows what to do this time around. So you have some more side effects. Does that make sense?
Got it. That makes total sense. That explains it so much better, because I was wondering that too, like, why doesn't it do that the first time around? But that makes total sense. Sandy has a question, and I know we talked about, it's just because I'm not a Lakeview resident currently, how can I get a vaccine and where? After receiving the vaccine, do I need to report the symptoms if I have any? So I know, Doctor, you mentioned npr.org as a good resource for folks to go there, put in their zip code and see what resources there are in our area or the area where folks live to be able to determine, who's providing vaccine right now. But this other part about after receiving the vaccine, do I need to report the symptoms, if any? I know my husband, who is older, he received the vaccine and he's been getting a text from, I think, the CDC, but I don't think that everybody's getting that. I think it was just where he got it. So what do we do if we need to share our experience?
Yeah, that's a great question. There is a reporting system called the VAERS reporting system. Now, I don't expect everybody to get onto that system, actually. That's for healthcare providers to report any problems for vaccinations. So what my advice would be is to report it to your healthcare provider that I have had this reaction that I'm concerned about. And if it's above and beyond what we've talked about, that's something that it should be reported. If it's something unusual that you're not sure of, that's something that should be reported. I would advise you to, again, seek out your health provider, or if you don't have a primary physician, then to maybe report it to that vaccine clinic where you received it at. Because what they can do is they can report it on this VAERS system. There's also an app that had been developed. Now, again, kind of speaks to who truly is able to do this and who is not. And some people will not be using that. I know I have enough of those apps. But that is another thing that the CDC has developed on their website, the cdc.gov. Where you can get the app and actually report your own symptoms. Another one is, just as you said, some people have been selected to participate in text messaging that will follow your symptoms. I think it's important to know that these are going to be the most researched vaccines that have ever been out there in history. We're going to have more information, and we already do have more information than we've ever had about any vaccines in recorded history.
Cool.
So that should give us some confidence that we're seeing very, very low safety problems with regards to the vaccines, and that is great news. If you told me we were going to have this low of safety problems with the vaccine, I'd be jumping up for joy, and I am still. So.
Yeah, it is. It's been terrific. Lan has a great question. Once you're vaccinated and after 2 or 3 weeks, can we drop the double mask? What would you say to that?
Question.
So yeah, I'm happy to field that question. I think everybody wants to get back to normal. I do too. I'm tired of COVID-19. It's been a rough year. I've seen lots of people that have been very, very sick. I also work in the hospital setting, so it's been tough. I, just as much as you, want to get back to seeing family, friends, not wearing masks, doing all those things. Right now, it's important to remember that we are, although we've seen a major decline in the cases, there's a lot of different reasons for that. And many of those reasons are because we haven't had recent gatherings such as Christmas and Thanksgiving. And because we didn't have a lot of people together, some of those effects, plus people wearing masks more consistently, have had a bigger driving effect for the cases to go down than the vaccine itself. We simply don't have enough vaccinated people out there for this to be the case as to why we are seeing the cases go down. The unfortunate thing too is when we're getting studies out there for vaccines, the first most important thing that we study is this thing preventative at preventing people from getting really sick? And not, is this thing preventing people from getting the virus, being able to transmit to others? We are still studying that. So it doesn't eliminate the possibility yet that we could potentially get the virus even after being vaccinated, be without symptoms or be minimally symptomatic, and then transmit it to somebody else that we care about. And so because we don't have that absolute information yet, we really can't say, hey, stop wearing masks, go back to your normal activities yet, because we just don't have enough information. The good
Well,
news is we're getting an abundance of that coming up through countries like Israel, who have high vaccination rates among their population. So we will know that information hopefully over the next couple of months.
hopefully by springtime, because Dr. Garcia, this question's for you from Jenny. And Jenny, it's a good one. She is actually at Lakeview Village and knows that the weather's going to get nicer, as we all do. So when are we going to be able to walk around without a mask at Lakeview Village, I think is the question here, and enjoy the springtime air? I mean, when we're outside.
Outside. That's a good question. I think that a lot of what we decide here, obviously, we have to take into consideration guidance from CMS, so Center for Medicare Medicaid Services, because there is sections of this campus that are licensed sections with long-term care and assisted living and rehab, and so a lot of that is going to come from guidance from the county, which will come from centers, the CMS, and we haven't seen that change yet. I've had a lot of people ask a lot of questions about why hasn't it changed, because there's vaccines now and the rates are down, but we don't, like Dr. Sears just said, we just don't have enough information to give an answer yet. And I'll be darned if we go back to 8 months ago where we were all like, what are we going to do about this? And the rates were high, and it's just not safe to say when or how or what yet. And as soon as we know, we want everybody to go out and do whatever they want to do too. But I don't know. I hate to say that. I just don't know.
Yeah.
And,
well, that's fair.
That's
yeah.
On that too, if that's okay. I think, again, just like Dr. Garcia, yet we don't know yet, how effective at transmission prevention this is going to be. These new variants, the UK variant especially, is more highly transmissible from one person to the next. And because of that, we're worried that if we let our guard down too quickly, we may allow for that variant to spread very rapidly. And we saw that in the United Kingdom. They had to lock down their entire country for weeks at a time just to get this back under control. And that was way more lockdown than they had to do prior, because that's how much more more transmissible the variant was. But it's also important to remember that getting outside, we'd rather somebody be outside and distanced and masks potentially off if you're greater than 10 feet from one another, than be indoors and do that kind of activity. So if you are going to, want to do something like that, outdoors is definitely the safer way to go about it. Yes, we definitely want you to wear a mask while you're around other people, especially indoors and outdoors if you're in close proximity. But yeah, if spring weather is great and you can see somebody from a distance, that could be a really good thing to do. And it's also healthy for you. We don't want to ignore the other health ramifications of being locked up for so long. So yeah, we want people to get outside, be able to take your mask off. But I think this is also the important thing to remember is that, we're not while masks are something we don't want to be familiar with for the rest of our lives, it's a small sacrifice that we're asking to make right now to fully get a hold of this thing and prevent other people from getting sick and prevent more numbers of deaths from happening.
Very
And I
good
think
point.
what I would say is like a thought as he talked through that, you know, masking is an easy thing to do. It's an effective thing to do. So it's probably one of the last things we're going to see that is recommended to go away. And I often question to myself, you know, are healthcare providers always going to wear a mask when you see your patients now? Is that something that's going to change forever? Because honestly, I've seen a lot less sick people in general.
Right.
The masking in the last year. My kids have been healthier. It's an interesting phenomenon. But yes, we want everybody, I mean, we want to get back to normal, but there's a lot of things to think about before that happens.
Dr. Sears, Keith is looking for some clarity on this question. So he says, so having taken the vaccine does reduce my being a vehicle for spreading the virus. Is this understanding correct?
Yeah. What we are seeing with some of the countries that have introduced large amounts of vaccine, Israel's one of these, which has an abundance of information that's coming back. We also have other studies to confirm this as well from other vaccines, that we are seeing a reduced transmission. Now, that may be 70%, say, for the AstraZeneca vaccine. That still means 30% of people potentially were transmitters. But it's also important to remember, based on all prior vaccines, what we'll expect, even from those 30%, is that the amount of time is still much reduced. The problem is that doesn't mean a person's absolutely not going to transmit. And this kind of speaks to what I don't think we answered quite, we didn't get to yet, was herd immunity, right? When do we get to that, right? Well, so if we get to a quote herd immunity situation where enough people are immune enough, not completely immune, but immune enough to have only cold-like symptoms from this, then yeah, we can start treating this as a cold, right? We can start treating it as something that's not as concerning, but we are going to be pretty far off from that. So that's why masking and those other measures are going to be still needed. And again, herd immunity is a combination of things. And I think we're using it too easily to say, okay, once we get to this percentage, everyone's going to be protected. That's not exactly how it works. Fortunately, once we do get a lot of vaccine out there and the people that have already naturally had COVID-19 together, we will get to a number where we see less amount of virus circulating. But we've just had so much virus out there that it's going to be tough to get to a point to where COVID-19 is truly gone. And what we're probably more expecting is, hey, let's get it to the point to where it's like a cold and not so much like a very, very severe virus that's causing so much havoc.
Sure. Peggy, thank you for your question, Peggy, because this is one that I was wanting to get to too. And that is the vaccine effective for a lifetime? Or are we going to be getting boosters annually, or do we know yet?
We don't know, but I keep saying I don't know. So maybe you'll have a more intelligent answer, but I don't know. But we don't know.
We don't know, do we?
But we do know that the vaccine manufacturers, the good news about these newer vaccines that we're using is they're much more flexible. They can change the vaccine quickly. And if we see a variant that is very much reduced in effectiveness for the current vaccines that are out there, we can change that vaccine very quickly and we can redose people. And I don't anticipate a 2-dose series again, more like maybe one single dose.
Like a flu shot, maybe, right? Like an annual flu shot.
Yeah.
Awesome. That would be nice, wouldn't it? Especially if they could would they be able to just mix them all together? We just get one. That'd be so great. Hey, Amy wants some clarity around that double masking. So understand, to keep the mask on, do we have to keep double masking is her question, which is a good one.
Yeah.
Yeah, I can speak to that. The CDC's advice on double masking is based on the fact that we do know that masks that have a tighter fit, especially, tend to be better at preventing a person from transmitting to another. Masks that are cloth, unfortunately, by themselves, have a lot of, they're more porous. So they allow little viruses to go through them more easily than, say, a disposable surgical mask that we see, which is why they're advising to wear the disposable surgical mask, then a cloth mask over it, is really because that surgical mask is doing the legwork for the filtering. And then the cloth mask is doing more of the legwork for the actual keeping that on your face and keeping it tight. So that combination has been found to be as effective or near to as effective as, say, these N95 masks that we're wearing.
Oh.
That's great news, because they're a little bit more comfortable to wear those two masks than N95. We can both speak to that.
Oh, I bet. Yeah. Here's another one. This is from Lorraine Morris, and I'm conscious of time because we're past our 11 o'clock hour, so I'll try to wrap it up here. Lorraine wants to know, if we get the vaccine at one location, do we have to go to that same location to get the second one? Do we know?
So you do not. I mean, obviously, it would be a little bit more seamless, and like how Lakeview did it, where you have the vaccine, and after you get your vaccine, you get a card about when you're going to come back that next visit and time. But we have had people that, say a facility was having their last vaccine clinic, and we want to get as many people as we can vaccinated. They get their first vaccine there, and then they do need to get it somewhere else, just because that particular facility doesn't have another vaccine clinic coming up. And that's where we kind of spoke to earlier, where we run into the struggles of finding that second vaccine. But again, it can wait a little bit. The important thing is just getting the first one. And as time goes, I think, I'm being hopeful that, every week we'll hear more and more about pharmacies opening up for getting whatever vaccine you need. Like Dr. Sears said, Hy-Vee. Anyway, so as long as it's the same vaccine, Pfizer, or Moderna, you might have to get it in two different locations. Hopefully not, but yes, it is possible.
Before I grab the two of you for a quick final thought, I just want to remind folks who are attending today, if other questions should come up throughout the day or whatever, we're going to give you some information here on the screen to reach out to Lakeview Village. This is Lynn Tenbrink's information. Her telephone number is 913-744-2447. She can get your question to Dr. Sears, Dr. Garcia, to both of them. You can also email Lynn at Tenbrink, and that's LTENBRINK at lakeviewvillage.org. And again, if you click on the email and you come back to this page that you're on right now, the form will be there and you can submit your question that way too. Either way, it will come to us. I also want to thank briefly Pam and Robbie for participating today as well. It was just great to hear about the experience of Lakeview Village and such a positive results that are going on there. And that certainly feels good. So doctors, if you will, any final thoughts here as we wrap things up?
I just have a final thought. Dr. Sears might have some COVID final thoughts, but just as this is kind of a Lakeview Village event, obviously, I've been here for 7 or 8 years. And I really feel like the last year has been challenging on so many levels for so many people, but particularly long-term care facilities, large communities like this that are servicing all sorts of different people that are all of, an age where this virus is really affecting a lot of people. And it has been truly remarkable to see what they've done as a team. I mean, the people here, the leadership, I think that they've probably worked 24/7 for the last 340 days. And I'm proud to be part of that. And I talk to the residents that come in to see me in the clinic, and that has been everyone's silver lining, is that, there's been a lot of sad things, but also the teamwork here. Every single resident has been so impressed with the way that they've helped keep us all together and as a community. And I think that they've really shown their true character in a time of crisis. And so I'm just really proud. So I want you guys to know that too, as a Lakeview Village, because all the vaccines, it's been, I hate to say a good experience, but it has, because it's shown that people can really do some really awesome things when they put their minds to it.
Absolutely. Dr. Sears?
Yeah, Lakeview's done a tremendous job. Anything that we've advised to them and being immediately adopted. So they really have. For me, for the vaccine front and COVID-19, it's been a divisive year too. Not only just the vaccine, and pandemic and but politically. But I think it's important for us to remember that over 1 million people in the United States signed up for a vaccine trial in which they didn't know what the safety was of these vaccines, and they signed up anyways. And they were all sorts of political spectrums, all sorts of groups, ethnicities, the most inclusive vaccine trials that we've ever had, the speediest trials, not only because they were, we needed the vaccine, but because we were coming together to make sure these were both very safe and to get them out there as quickly as we possibly could. There's been so much cooperation and so many people that volunteered that I think it's important for us to remember that Americans still care about each other. And many of us signed up for trials not knowing what these things would do to us. And now we have the data. We have all the data that says these are super safe. And we have that thanks for those people that did that for us, that provided that protection to us by volunteering. And now we just need to take a little modicum of that risk, of little side effects that we talked about, and take that for ourselves, for our family, for our community, just like they did, not knowing that they may have had even more risk. So it's important for us to remember that we're all in this together. The vaccines are safe, effective. Get your vaccine, get whatever comes to you as soon as you possibly can. Get the first vaccine, prevent yourself from being the person that, transmits to another person in any way possible.
Thank you so much for that, for both of you to share with all of us today. And certainly thanks to all the attendees who came up and asked some terrific questions too as well. We so appreciate them. And just briefly, what's next at Lakeview Village? Well, there will be another virtual event next month in March, and it's all about organizing and downsizing, because spring is here and that's what we're supposed to do, right? We're supposed to get our act together and get rid of all that junk in our house. So we're going to have a terrific event around that as well. Dr. Sears, Dr. Garcia, thank you again so much. We appreciate you.
Yeah, thank you guys for having us.
Absolutely. Have a great day, everybody.
Bye.
Bye-bye.